Maybe we should start, Adrian, since some are punctual.
How many do we have? One?
16.
Good morning, everyone. Welcome to the webinar. We have on the...
You're still in practice session. You need to start the webinar. Okay, now we started.
Okay. Good morning, everyone. Welcome to the
Recording
webinar
in progress.
we're having on the epidemiological course that will be offered on PAHO's virtual health campus. We will give a few minutes so that more people can join, and then we will start the webinar. In the meantime, I'd like to do some housekeeping for everyone to let you know that this webinar is broadcasted with simultaneous translation in English and in Spanish. The icon is at the bottom of your Zoom screen. You can listen in the original audio, or you can switch to English and Spanish. And let's see, we have 128 participants now. All right. It's a few minutes past, so we are going to go ahead and start the webinar. Again, welcome everyone to the webinar we're having to launch the course on the virtual health campus for epidemiology in the Americas. We have a team of people here for our panelists that have been very much involved in the development and the design of this course, and we are excited to bring this to you. The agenda has been sent out to everyone. We have Dr. Lara Magaña from the Association of Schools and Public Health Programs. We also have our other collaborators from A.T. Still University, and we have Jose Antonio Escamilla, who used to be a PAHO employee who has recently retired, as well as Gabriela Rodriguez from the virtual campus of public health here at PAHO. Let me also say to everyone that Dr. Sebastian Garcia will join us later. He is traveling, so he will speak later in the webinar. So I would like to please extend a welcome to all the panelists and turn to Laura to open up the seminar. I will stop sharing the screen now.
Sure, thank you, Adrienne. Well, good morning and welcome to the launch of the online course, Introduction to Epidemiology for Health Systems in the Americas. I'm Laura Magaña, President and CEO of ASPPH, and I'm honored to welcome you all. If there ever was a perfect timing for building public health workforce capacity in our countries, this will be it. The COVID-19 pandemic exposed the weaknesses in our health systems and made clear the need to strengthen our health systems and workforce, revitalize essential public health services, and enhance emergency preparedness and response capabilities. The challenges of the public health are many and have never been greater as our lives and our environments become more complex and interdependent. That is why I believe the timing for launching this course is just right. The public health workforce requires a constant updating of acquired competencies, as well as learn new competencies as new challenges arise in protecting and promoting the public's health. The pandemic has demonstrated the need to develop competencies beyond the traditional ones to be most effective in responding to crises. So skills in communication, data analysis, forecasting, and the new methods and approaches in epidemiology are essential to maintain healthy communities. Given the importance and the magnitude of current and future challenges to keep the public healthy, it is important that we all come together across sectors, across disciplines, to build a robust and successful public health workforce. We must avoid fragmented efforts and use a systems approach to ensure that the public health workforce is adaptive, agile, and fit to meet the diverse, ongoing, and future public health challenges. We can no longer work in silos and must instead embrace the importance of working together towards improving global public health through a robust public health workforce. That is why ASPPH, the Association of Schools and Programs of Public Health, are proud and delighted to partner with the Pan American Health Organization, PAHO, to work together and advance the capabilities of the countries to better perform the essential functions of public health. At the same time, for this course, we have also engaged one of our members, the A.T. Still University, for their expertise in delivering education and training. In this vein, we are very excited to launch this introductory course, which provides the necessary elements to develop the basic skills fundamental to epidemiology as a basis for the development of analytical skills and problem solving in epidemiological practice. The contents of this unique course facilitate the fulfillment of two essential functions in public health. Number one, the monitoring and evaluation of health and well-being, equity, the social determinants of health, and the performance and impact of health systems. And number two, surveillance in public health, control and management of health risks and emergencies. This course is part of a complete program that will have different levels. So the workforce can actually enter at any point according to their knowledge, experience, and expertise. The levels include introductory, basic, intermediate, and advanced. And in each level, the program includes modules with different topics and competencies to be developed. So this agile and innovative model will allow the workforce to assess and decide where they want to start. This unique introductory level course is for people working in public health departments, particularly at entry level, public health or epidemiology roles as decision makers in charge of developing policies, planning programs, and implementing them in public health departments and health services organizations with little to no formal training in epidemiology or public health. The unique features of this course are, it is offered in English and Spanish. It is interactive in nature, such as clickable images, interactive PAHO websites with relevant and real-time data and topics, interactive graphics, and interactive content. The course data offers a variety of learning activities to accommodate various learning styles, exploring sites, videos, interactive timelines, reading, listening, formative assessments. All of this is included here. It is fully ADA compliance, the Americans with Disabilities Act, so including closed captioning, color schema, color contrast, font size, etc. The course is accessible on various devices such as phones, tablets, and computers. Assessments and learning activities align with the Bloom's taxonomy based on the modules level, and assessments also include the application of local and regional resources to help participants familiarize themselves with epidemiological resources and conditions in their area, as well as with PAHO resources. So we are very grateful to our advisory committee from more than 15 countries that reviewed the content and gave us great feedback to ensure the content was country relevant. I encourage all of you to take the introductory course and send us your feedback. This will be a course that will be continuously updating as the evidence-based knowledge on the area of epidemiology continues to arise. And we will continue to develop the other levels in order to deliver them in the next months. So stay tuned. With that, I again thank you, all of you, for your interest, and thank PAHO for a great partnership and ATS Steel for their commitment and expertise. So thank you, and back to you, Adrienne.
Thank you so much, Dr. Mcnatt. That is a very informative introduction to the course that we'll get into a little more. And thank you for allowing to provide us with that background. I will now turn to Dr. Jose Antonio Escamilla, who has been the advisor in charge of leading the effort for this course. He also has a background that he was involved in MOPESE, which we have some interesting history really in transforming the MOPESE course to an online e-learning course. And that was really our goal here, to be effective and use the latest of technology and that. So Dr. Escamilla will give us an overview of the course and a little more background in it. Over to you.
Muchas gracias, Adrienne. Buenos días a todos.
Thank you very much, Adrienne, and good morning, everybody. It is a pleasure for me to be here. Can you hear me well? Perfect. So I'm going to share
mi pantalla.
my screen.
Bien,
Okay,
estamos viendo, ¿verdad? El modo de presentación.
you can see my presentation, right? Okay.
Hemos llamado a este proyecto
So we've called this
fortalecimiento de la
project the
capacidad
strengthening
epidemiológica
of the epidemiological capacity in the healthcare systems of the Americans. And the relevance of it, which is a historical part of it, I want to mention real quick, is that I basically believe that this great background is what has led this process. Of course, the recognition that epidemiology is the basic science of public health,
totalmente reconocida, el
that has
compromiso
been fully
intrínseco
recognized,
de la organización de la OPS
the
para
very
fortalecer la
explicit
capacidad de
commitment
respuesta
of PAHO to
epidemiológica
strengthen the
en los países,
capacity to
desde luego
provide
la creciente necesidad
epidemiological
de
response in the
investigación
countries, and
relativa a las
also
epidemias.
the growing
Esto realmente despertó
intelligence to
en
respond to it as
2016
well.
que se dio
Something that
entre el
happened
año
in a process
2010.
between 2008 and
Lideró
2010
en ese momento
that at the
la creación de
time
la gran
was
unidad de
leading what was
vigilancia
called the great
con
area
enfermedades
of surveillance,
y esta
prevention, and
participación
control of
ha sido
diseases,
muy intensa
and
en
a very
diferentes áreas,
intense
salud
participation
sustentable y salud ambiental,
for
sistemas
sustainable
financieros.
areas and environmental
En
health,
ese
as well
momento,
as
quien era
systems and
el área de
services for
vigilancia, el doctor
healthcare. And
Yago
then that at
Barbosa,
the time, Dr. Diago
hoy
Barbosa, who
el
was a leader
director de la
of
OPS.
epidemiological
Y
care, who's been a
hicimos
director of
reuniones
PAHO
a
at
través
that
de toda la
time,
región
with many meetings in the region with
con la academia,
epidemiologists, with the
con los
academia,
servicios de salud,
with
con los
healthcare
servicios de salud ambiental,
services, with
y
environmental services,
con el propósito de crear un
with the
proceso que
purpose to
permitiera
create
desarrollar
a
la práctica y
process that would
eficiencia
allow to
en
develop
el
the
marco de los
practice of
sistemas fronterizos de salud,
epidemiology in the
para ello
framework of
fortaleciendo así la
healthcare
capacidad de respuesta
services
en el tema
that
epidemiológico en los
strengthen the
países
capacity
y
of
fortaleciendo
response
también el
in
desarrollo de las
epidemiology in the
competencias
countries, and
sanitarias.
also the basic
En el año
performance of
2010
public health
se propuso
services.
este plan regional
In 2010,
y
this regional plan
con el
was
tiempo
introduced, and in
hubo
time,
varios procesos.
there were
Uno,
several
Adrián lo mencionó
processes.
correctamente,
Adrian mentioned it quite very rightly,
son módulos para
the
el
Montpellier
entrenamiento
process
y
for
capacitación
the
epidemiológica,
training
con varios años ya
of the
realizados
epidemiology care with several
en
years,
OPS
not
en
only in
algunos
PAHO
otros países
and even in
fuera
other
de la región,
countries outside the region,
pero siempre con la idea de
but
poder hacerlo
always with
totalmente
the
digital
idea to
en
actually
realidad
be
virtual.
able to
Así es
have
que
it online.
con
So
base en aquel plan,
based on
vamos a entrar
that
en detalle,
plan,
pero
and we're
básicamente
not going to go
fueron
into much
el
detail,
trabajo que se hizo en ese
but
periodo.
and that work that was
Era
done at the
importante
time,
empezar,
it was
por
this, and it
ejemplo,
was important
con
to
básicas de epidemiología aplicada,
start with
que
basic
permitieran
competences
identificar problemas
that
sensibles
would
a
allow
la brevedad posible,
to
analizar
tackle
información
these healthcare
y
issues and
implementar
analyze
respuestas adecuadas
information to see
a cada
that they
demanda.
could get a
En ese
response that would be
momento
suitable for
partieron
the
tres niveles
problem at the
básicos de
time,
formación,
with
nivel
3
básico, nivel
basic levels
avanzado
of
y
training: a
nivel
basic
intermedio
level
más
of surveillance,
especializado,
an intermediate
que
level, a
permitiera
more specialized level that
identificar cualquier
would
problema
also allow to react to any
epidemiológico
situation
en cualquier lugar.
or any
En ese
epidemiological
plan
issue
original
anywhere.
se
With
plantearon
that original
los tres
plan,
niveles
there were
que
those 3 levels set
fortalecen la
with
prevención,
those
la
particular
presentación
purposes,
e
strengthening, for
identificación
instance,
de
the
problemas, el
identification of
análisis y la
issues,
conducción
the analysis,
de programas.
design, and correction
Con esa información
um, of the issues so that they could have a proper response. And so with that information and going back to all the historical of the region, we were able to start working to put together a proposal that would allow us to keep on strengthening these efforts online.
Nos acercamos a la ASPPH, a la doctora Laura Magaña.
We are close to the AES-PPH, and Dr. Magaña already told you the story. These were colleagues in the field and told us about the experience they have had. And we decided to put up together this proposal with AES-PPH. We proposed the cooperation with the AT Still University and they participated in the creation of virtual programs that have lots of success. And with them, we built the work program and created the third expert committee. And you see the other universities that were part of this work process. The US, in Mexico, you can see Puerto Rico, Brasilia, many other universities. And for myself, what I did was to approach several colleagues in this field who have stepped out of the organization, and I have to thank the time that they dedicated to this field. And hearing all epidemiologists together in the association in this department is Intelligence for Health and Action, and other departments as well from PAO participated very enthusiastically. They gave us suggestions, and all the technical departments participated as well. And I thank them for all the time that they dedicated to this. And also public health gave a lot of interest to this initiative. And you see here a colleague that is going to talk to us that has been essential for this process. A first comment, just for what I said in this regional initiative, but something that appeared during these discussions was the fact that in our region, and it looks like in other regions as well, there is great problem with health services. We require a change. We have a change of staff way too often, and we place people in public health who have great intentions but do not have a very clear basis or a training, a very basic training in epidemiology or public health. And I told them that we have to have an introductory level that could facilitate the transition to other levels. So what you are going to listen about today has to do with this introductory level. And what we have tried to do is to place some knowledge in public health that will include and take this channel toward the use of epidemiology and the reinforcing of the response in the different countries. We had something important that happened in 2021 while we were having these discussions, an organization of professionals of public health, and we advanced. It was a great opportunity to use all this knowledge and put it in the proposal that you are going to see here. This advice puts together all these academia and public health organizations, not only in Latin America, because they help us have this minimum of quality in the care for human resources care. With this, we presented a proposal with 4 levels of courses in epidemiology, and in this, what you are going to hear about in this occasion is about the introductory course. I do not go over that because my colleagues are going to talk about that, but they'll give you an idea on how this process can be created. Thank you very much, Adrian. And I just give back the floor to Adrian. Thank you very much, Jose Antonio.
For that informative overview of the course and the effort to date, and a little bit of history that we have. I would like to remind everyone that you can put your questions and comments in the Q&A and the chat before moving on to Dr. Mary Catherine Mcnatt, who is from AT Still University, and she and her team have been extremely valuable in bringing this online approach and the curriculum, as well as the design of this class, so that we can use on the virtual campus in a very new and exciting way. So we are excited to have her debut the course. Mary Catherine, over to you.
Okay. Thank you, Adrian. I'm Mary Catherine Mcnatt. I'm the Public Health Department Chair at AT Still University. And today, Louise Smith, one of our instructional designers at the College of Graduate Health Studies, is going to be helping me navigate, and we're going to show you some of the features of the course. And we will have two instructional designers in the chat, Susan Thomas and Sue McDaniel, answering questions. So please put their questions in the chat as you go. So they will be there live helping along. So feel free to answer questions at any time. As Dr. Magana mentioned, the course is in English and Spanish, so anything we show you is going to be in both the courses, the English version and the Spanish version. She mentioned the bandwidth. That's really important for our courses in the Americas. So that means that our courses can be accessed in rural areas, remote areas, anywhere, and you'll get the same use of the courses, whether you're, out in the jungles or out in an area where there is no high-speed internet, which was really important to our learners. So that was something we made sure. All of the features of every single course, the interactive learning, a lot of interactive learning features do require a lot of high bandwidth. So we made sure to choose things that don't. So everything you see is going to be not only a low bandwidth thing, but you can access it, she mentioned, on numerous devices. That means if you only have a cell phone or a tablet and don't have a computer, you can turn it any way and it's still going to function the same way, which was another really critical feature. We made sure to use fonts and colors that were the most visual to the learner, so that you could, again, turn your devices any which way, which is, if you're looking at something on a really small device, that's something a lot of people don't think about, but it's very important in the learning process because you don't want to get visual fatigue or hearing fatigue or anything like that. So these are little things that, while they might not sound so big, if you're looking at multiple courses, can be very critical. Our courses do offer a variety of learning activities, like she said, to really require formative assessments. Reflection is really important in the learning process, and we're going to go through some of these in just a minute. Again, closed captions. Each module also offers a glossary and references that are relevant to the content. So with that, I'm going to ask Ms. Louise Smith to go ahead and screen share, and she's going to show you how you can access the closed captions, the glossaries and the references. And in that, it's also important to note that the content in the courses is different what you see. So there's no sort of death by PowerPoint that you see in some of the courses. The narration has unique content compared to what you see on the slides. And so the learner has the option of listening to it either through the module narrator, or they can read it through the closed captions. And so I'm going to turn it over to Louise here. I believe she might be on mute.
Good morning. Can everyone see my screen?
Yes.
I just want to make sure. Okay. So what I've done is pulled up a number of the different modules within the training, and we'll just kind of highlight what some of them unique features are. As Mary Catherine said, it is in both Spanish and English. So everything is user-friendly for the language, including the commands, the menu selections, all of that, depending on whether you choose English or Spanish. We do have the closed captioning feature, which is located down here, that accompanies the narration. And so you'll see the closed captioning comes there at the bottom.
We can't hear the narration.
I didn't share my sound. Would you?
Oh, okay.
So, so we have the narration is both in English and in Spanish, and then obviously the closed captions mirror that. So for the menu, the user is able to begin the training and then move through it sequentially. Once they have completed a slide, they are able to go back. So if I'm in slide 8 and I decide that I wanted to look back at something, all I have to do is click on slide 5 and it takes me back to that point in the training, which is helpful for people who want to review information. So
I'm sorry to interrupt you, Louise. If you could just talk a little slower and not as fast so that the interpreters can interpret properly, and if everyone else could do the same when they speak. Thank you.
Thank you. Thank you for that reminder. So, so one of the things that we really wanted to do was engage the learner in interactive learning. So when we design the slides, we design those with that end in mind. So this is an example of one of the ways that we can engage the learner. This is a slide that discusses forms of racism. And so what the learner can do is just hover over and the information will pull up. And again, this will be in both English and Spanish, depending on where, what language the user chooses.
So by having clickable images, it engages the kinesthetic, different various learning styles. So you have, whether they're kinesthetic, visual, or auditory, by having these multiple modalities, you can click, you can hear, you can see. And so it engages various learning styles, which increases their ability, the learner's ability to retain the information. And so this is sort of what you're seeing here with the different modalities on each individual slide. So there's different functions for the various learning styles.
And as I progress to the train, I'm sorry.
Can you point out the glossary and the resources?
That's what I was getting ready to do. As a learner, as I progress through the training, if it's new information, I may come upon terms that I've seen already in the training, but may not remember what the meaning is. I can go to the glossary and it will pull all of that information up so that I can then scroll down and look for the definition of something that I need to know for a later slide. We also have the resources in the upper right corner. And on these are all of the different links that you can go to for additional information that supports the content within this training. So if you're interested in a specific topic that's addressed and you would like more information, you can always look at the resources and link out to those. Most of those actually live on PAHO's site, so that we're keeping the information current, and when we update, we make sure that we have the most recent information. So I want to show you just some of the other interactive elements that we have in our training. So this one is what we call a 360 photo, and it allows users to actually engage in it. When they click on a link or a hotspot, it brings up more information. And then this also gives them the ability to read more. And it just gives kind of a different, unique learning opportunity as well as a perspective. When we're describing, in this case, I believe it is the disparities, health disparities. When
social determinants.
Oh, sorry, social determinants. So when we're looking at that, we're actually getting the visual impact as well as the knowledge behind it. We also, again, wanting to present the information in usable ways in different formats. We have an example here, and this is in the Spanish version. So you can see how the menu still remains the same, but everything else is user-friendly in the Spanish language. So this is an example of a timeline, but we also wanted to give users the opportunity to explore that. So we built an interactive timeline as well. And even within this timeline, we're giving different options because we can then allow the user to do a 3-dimensional walk through the timeline of PAHO. And when they click on something, it gives them more information. And then they also have a link where they can link out even more information. So if they're curious about a specific event on the timeline, they can learn more information. So that was kind of a nice element that we added in. We also wanted to provide a way, instead of just having links for people to look at, we wanted to provide a way to engage them in, obviously, readings that we want them to explore, to learn more about epidemiology. And so we have interactions where they can choose readings to explore and increase their knowledge. And then, I think I wrote 2.1.
One of the other important features, while she's pulling that up, was these courses are self-run and they are asynchronous, meaning anyone can join these courses at any time and complete them on their own time. So we have an avatar that leads the learners through the course. The avatar is very lifelike and sort of as a guide, and it's not cartoon-like, and it's there to help engage and guide the learners with real applicable material. So all this examples in the course are real life epidemiological examples of relevant content and health issues and statistics that are in the Americas. So anytime there's an example, it's real actual examples and real data of something in the Americas. So whether it's like, here she's about to show you a dengue, but whether it's Zika or violence, traffic accidents, anything like that, we do use real epidemiological data in the course so that they can actually learn with real data and learn actual resources that are in the Americas to guide them back to it. Often with PAHO sites or WHO sites or something that they can see, so they become familiar with where they can get extra resources and references in their area and in their region.
And as Mary Catherine said, we want everything that they have to be real time, and we want it to be something that's applicable to them. So in the training itself, we talk about data sharing, and the example we use is dengue. And PAHO has many different resources available, and we wanted to link those back. So instead of taking your screenshot of a static picture that's not going to change for data, the user can link out to an actual applet on the PAHO site. They can choose an area specific to them and then get updated real-time data. And so this is constantly being updated. As PAHO updates their data on the site, it automatically is updated in the training. So it's real-time, real-world, and applies to the user specifically. And so we have a number of these applets throughout all of the modules that allow the user then to gather information specific to their region and locality. Mary Catherine, was there anything else that you wanted me to show them?
We hit the unequal scenes.
I did not get that pulled up. I apologize.
Okay. And then we do have knowledge checks throughout the course. We can't pull one up because it shows lifetime. And those are embedded in there so they can help the learner reflect on not only the content, but make sure that they're giving formative feedback on what they're learning as they go on. So as they'll learn a little bit, they'll go like a quarter of the way through a course, and then they'll have a couple knowledge checks. They'll go a little bit more through and have another knowledge check. And so it helps them go through the course just to make sure they're learning as they go. And if they get a question wrong, it'll direct them back and say, I'm sorry, this is incorrect. Please review XYZ. And so it helps them kind of know what they need and where to reflect on. And, like we said, reflection is a very important part of the learning process. And so it kind of shows through. I don't know if you want to show one of the avatars.
I think that's the one. And I'm not finding one, Mary Catherine. I apologize for that.
Okay, not a problem. But that's sort of a broad overview of the course, and each module is broken down. There's an avatar. Each module is broken down into segments so that they don't have to do a whole module at a time. So they are broken down into smaller segments. And today there'll be a beta version available of modules 1 and 2. And then next week, all 5 modules will launch on the virtual campus site. All right, thank you guys.
Thank you very much, Mary Catherine and Louise. We really appreciate that overview. As Mary Catherine said, the beta version is available to look at modules 1 and 2 today. That has been included in the chat. Also, all 5 modules will be available on the PAHO virtual campus of public health, and that is also included in the chat. So you have the beta version links where you can find Spanish and English, and the other links available on Monday, where you can have access to all 5 modules, and that is in the chat, a link for the Spanish and a link for the English.
Adrienne?
Yes?
Folks have been asking in the chat and in the question and answer about cost related to these courses. So I thought you might want to address that.
Yes, great question. The virtual health campus is something that PAHO offers for free. It is really there so that we can strengthen different competencies in various areas of public health. So there you will not only find this course, you'll find many other courses that we have. And we have the pleasure of having Gabriela Rodriguez here from the virtual campus of public health. So this is a nice transition. All those courses are offered for free. You simply have to register for those courses. We keep track of who comes into the course, which organizations they're from, what positions you have in the course, so that we have full insight into how these courses are making a difference. And we also have an element of evaluation as well for these courses. So thank you for that question. We'll continue to answer questions and have a question and answering period at the end of all the presentations. So for now, I'm going to turn the mic over to Gabriela Rodriguez. Thank you.
Hello everyone, good morning. Bueno, yo voy a hablar en español y voy a compartir algunas cuestiones
I'll be
relacionadas
speaking
con
Spanish and sharing some
este curso.
issues concerning the course.
Perdón, pero estoy
My
escuchando
apologies.
a la
Looks
traductora.
like I'm hearing the interpreter because I'm in the English channel. Estás en el canal de inglés.
Okay. Un minutín, por favor.
Okay.
Ahí está.
Okay. Perfect.
Ahí va. Bueno, mi nombre es Gabriela Rodríguez.
Okay, so I'm Gabriela Rodriguez. I am representing the online public health bank. Gabriel Stocks, who is the coordinator of the campus, is apologizing because he can't be present as he is in a mission, but he congratulates you for the launching of this course. What I do want to tell you a little bit is about the online campus of public health, which is the educational reform of PAHO, and the way the online campus is based on the technical cooperation between the different sectors. The main goal of the virtual campus is the competences in public health based on a permanent model in education in health. And so every course that is developed in the platform will have an impact on the everyday health practice. So with that idea that the campus is the educational platform base for the technical cooperation, what we try to do is for the courses to always try and develop capacities and competences in public health for them to be open and interoperable, that they can link with universities, public health institutions. There are courses that if you do it, you offer credits in your countries and in different institutions to be able to move on healthcare careers and educational careers. And then on the other hand, the collaborative work with other areas of the organization. And in this particular, we are working with the area of evidence and public training directed by Dr. Garcia Soso, whom we thank very much for his work. And I'll show you some other works we are developing with this area. And right now we have about 70 courses of self-learning that are self-managed and an average of 25 regional courses with annual tutoring. So that makes us be very accurate for all these courses to work with quality and not having any issues at the time of the launch. We also have a webinar repository and the YouTube channel, and we work with a note of countries that we partner for the development of the courses in each of the countries with the PAHO office in that location. Also, behind that and the developments done by each of the teams, we have like in data intelligence, looking into the functioning of each of the courses and looking at statistics that help us manage better the proposals. And a little bit of responding a little to that, our courses, we believe that the courses that can be provided free, that are for the public good, the self-learning courses have about a lasting of 2 years in the platform from the moment they're open, and you can turn them around without a problem. Anybody who obtains the user and the campus. We have diversified and growth from the starting of the campus, which started in 2013, and the first one is in 2017. And we have this chart, how it started since 2014 and how it was really flying from the pandemic when it offered a possibility to give response to issues that were usually being done in person. Very recently, we reached 2 million users, which is something we really are cheerful about. And as you can see, the diversification of the professional groups is one where we have about 37% of nursing staff, 31% of physicians, and 13% of students that are taking the courses and the virtual campus divided in these different type of healthcare services, primary healthcare, hospitals, and management. What makes relevant and unique this online courses, and particularly this one that has been developed by this very skillful and competent team that have put together this wonderful course? Well, first of all, it's a self-learning course that allows the use of various languages, multimedia, hypertexts, and what the team has put together, the access to updated resources, the possibility to exchange in forums with experts, and as I said at the beginning, the possibility to bring knowledge to practice through questionnaires and activities. To access this course, when you do access, you will receive a participation certificate with a definition on the number of hours this course would last, which allows you to do the equivalences in your spaces of educational work with the signature of Adrian, who is now the director of PAHO until the new director takes on. And then in every course, there is a help desk that helps you look into your technical issues. So if you had any difficulty to access to any resource, or if you find out about something during the time the course lasts, the campus desk help can answer your questions. Once the course is available, which will be as of Monday, in order for you to access, you have to start your session in the online campus of public health or create an account. I'm showing it here in Spanish, but you also have it in English and some other languages. To create the account, then you click on when it says one create account, where you fill out the information and follow the steps that they send you via email. And when they do that, you'll start your session, and then you'll access to the sector of self-learning courses, which are the courses that are free.
Here you can see it in English, where it says create account. Once you access to these self-learning courses, you are going to find all the courses that we can present, and you can choose by theme category. These are the courses that we have launched, and at present, from the courses of evidence and intelligence for health action, we have 4, 3 in Spanish and English, and 1 in Spanish. And we have 7 new courses in development, under development. So the epidemiology course for the Americas, you can find it in this link that we are going to share in the chat. It'll be available from Monday. You'll have an introduction to the course, and you'll be able to access the course to see it in full. What you have is a final questionnaire, and after that you will show us your satisfaction with the course, and we'll give you the certification. I'll do a bit of so that you can see it. I want to thank the whole team. You have our channels for the virtual campus, and I am available for any questions. Thank you very much, and I want to thank Susu, San Luis, Jose, Adrian, Lauren, Andrea. Thank you very much.
Gracias, Gabriela, for that informative presentation about the virtual campus of public health that we have in Pajo. It is a valuable tool we have seen throughout the pandemic. It has been used more than ever throughout our region to build competencies among health professionals, and also students in academia and in other areas. So it goes even beyond our region. People use it from other parts of the world as well. So this is a truly valuable tool that really is a gift to the world. But its intended purpose is doing exactly what it was made for. I would like to open the floor to the Q&As. I know that there is a lot of interest. I see many questions in the chat and the Q&A. I will say a few words on behalf of Dr. Sebastian Garcia if he's not able to get off his plane and join us. He hasn't landed. We've been texting as this webinar has been going on. So let me open the floor to the questions. Some of you have already gone to the beta version, I see. So that is great. And I want to let you know that your feedback on these courses will be invaluable. And there's another question about, will there be additional courses and will there be announcements when those courses are available? Absolutely. We will announce those through our network and through the virtual campus of public health and all different formats that we have to get the word out. And this is a dynamic and evolving process. So the idea is that as this grows and as it's used, we improve it continuously. It's not a one-time thing that we have out. So maybe everyone can also help me with some of the questions, our team, that are of interest to everyone. The questions from the YouTube chat. Gustavo, if I take the course, will I get a diploma? It's not a diploma, but there's a certificate. So in order for you to get the certificate, you have to complete all 5 modules. There is a little bit of a testing format and questions related to each of the 5 modules that you will have to answer in order to complete the course and get the certificate.
You'll be ready for the test though, because you'll have your little mini knowledge checks throughout. So it's not a scary process.
Exactly. Buenos días desde Venezuela. ¿Cuándo sería la inscripción para iniciar? You can begin modules 1 and 2 today in the beta version, and on Monday, all 5 modules will be available. So you can start today as well.
Yeah, and your beta version content will be transferred over to the PAHO virtual campus, so you won't lose your work. So you won't have to repeat it.
And then a question, ¿cuánto tiempo tengo para completar los 5 módulos?
How long do I have to complete the 5 modules?
On your own time, however long it takes you, so you don't have to feel rushed. And if you do need to retake the quizzes, you can, and your little avatar will help guide you through that. So you'll have your knowledge checks throughout, and she'll tell you what you need to review, and then you can go back and review the content that you need to review, so you don't have to feel rushed in any way.
Okay, great. Let's see, I'm looking for more questions. And we're sorry some of you have had problems listening to things. We have recorded the webinar, so yes, it will be available to those who were not able to join us today, and also to those who had problems listening to the webinar. Other questions, I'm trying to scroll up and see as much as possible. Let's see. We will put the links again. They've been shared for you, but if we could also put them again in the chat. I think some people have missed them because there's so many questions and comments in the chat. So if we could put those links in the chat again, I know I've put them there at least 5 times already. All right. I think most of those questions that came up were the same for everyone. And I think we've answered most of them. If we haven't, please raise your hand. You can ask the question now.
I do want to thank our advisory committee. We did work with a wonderful advisory committee, and it really helped develop the course. It went from originally 4 modules to 20 modules to really enhance for the course development of everything. So very thankful for the advisory committee and how this came about.
Absolutely. Thank you, Mary Catherine, for that.
Yo quiero agradecer en particular, Edwin, si me permites, Andrea Silvia.
Yes, if I may. And Gabriela, and everyone else have been very important in this process. I just wanted to interrupt to thank them.
We don't want to belabor this. We want to make sure that you get to the class, you get to use it. I think this has been a great overview from everyone on the panel. As we said, you can access the 2 modules. Whatever you do in the modules will be kept, and all 5 modules will be accessible on Monday. So I want to thank all members of the TAG, AT Still University, ASPPH, and the virtual campus, and everybody else that we really pulled into to get their opinions, to look at this, the translators, everyone. This was a very exciting project to work on and to bring a new format of online courses to the virtual campus. So we are very eager to get your feedback and to have you using it, and really also to go into other dimensions of epidemiology. that it doesn't exist in a vacuum. Epidemiology is very dynamic. We also had to look at how it plays out in real life. So we had to look at social mobilization, sensitization, also look at stratification by ethnic groups, by economic groups, all of those things that are so dynamic and really have an impact on epidemiology and how epidemiology affects our health, improves it, or helps us understand how disease and conditions move about and how they change our lives and have an impact on our health. So this course will bring greater understanding to that, and we look forward to improving it as we move along. So thank you to everyone. Thank you to participants for your enthusiasm, and we look forward to hearing back from you. Please go out, enjoy, do the modules, learn, provide feedback within the modules. It's very helpful. So thank you very much for joining us for this webinar.
Thank you all.
Thank you.
All right.
Gracias, ¿eh?
Bye-bye. We will close now.
Okay, bye-bye.